Imagine taking a drug that's supposed to beef up your bones and keep osteoporosis at bay. Then one day you hear a snap in what should be the strongest bone in your body. It started happening to one woman after another and finally prompted a new FDA warning about sudden fractures that can be incredibly dangerous.
I just heard something snap and I went down.
Sheridan Powell of Greenbelt says when the paramedics got there and tried to straighten her right leg for the trip to the hospital, the pain was excruciating.
I knew that it had swollen up because I was wearing a pair of jeans and I could see it rising in the jean. And then later, after the surgery, I found out I needed 4 pints of blood because I was bleeding.
This clean horizontal break is more of a type you would see with a brittle bone, like a piece of china that just had a stress fracture and completed.
Dr. Robert Bunning is an orthopedic surgeon with National Rehabilitation Hospital. He started seeing this rare type of femur fracture in more and more patients with one connection. They had all been taking bisphosphonates, drugs like Fosamax and Boniva. When taken for more than 5 years, the drugs could trigger these clean breaks in the thigh bone or femur with no fall or trauma beforehand.
The first case I saw of this that came to our hospital was a very active antique dealer, and she was carrying groceries into her house and felt her leg snap and fell to the ground and had broken both of her thighs through the middle.
Dr. Bunning says many of the victims do feel telltale leg or groin pain. Sheridan did, but never linked it to the Fosamax her gynecologist had prescribed.
I have a titanium rod and 4 screws. That's how they put the femur back together.
Now, Sheridan underwent intensive therapy at National Rehab Hospital and now fortunately doesn't even have a limp when she walks. But she was out of work for 2 months and always lives with the thought that even though she stopped taking Fosamax, one day her other leg could break as well.
All right, now this drug, as you say, is supposed to make your legs and arms stronger. It makes them break. How is that possible?
Here's the thing, it's kind of hard to understand, but basically these drugs stop cell turnover and from cells from being reabsorbed into the bone. Now that stops the loss of bone mass and keeps them from thinning out, which can prevent minor fractures. Over time though, in some cases, these built up bones can actually become more brittle and snap. That's what experts think is happening.
Okay, so the thigh bone, of course, gets a lot of pressure.
Exactly.
Snaps
and again,
under the strain.
and not kind of a break from a fall, but just a sudden snapping of a brittle area.
That sounds
It's
awful.
hard to believe. Tomorrow morning at 6:12, I'll have the top ways women can avoid getting osteoporosis in the first place and which bone robbers can make the condition worse.